Hi guys, this is Natalie Zanga with my audio of the day. So I wanted to do a talk about how do you differentiate between religious practices versus psychological factors. Many, especially who were not brought up in this type of lifestyle that then choose to live a more of a practicing lifestyle, don't realize that there's a fine line between what is considered religious Jewish practices and sometimes it could be an like an off track of a psychological factor that can get camouflaged behind religious and ritual practices. It's very important for us to take a moment and realize that educating ourselves, reaching out, getting more information, getting more resources is essential and highly, highly recommended, especially when it comes to different factors that family members or individuals we live with might be impacted by it. We need to be mindful of that, even as far as rabbanim and religious figures that we go to need to be educated in these areas. Just like, if a person is having heart difficulties or their left arm starts hurting or they see blurry, they don't go to a Rav and say, Rav, my heart hurts, and the Rav says, say some Tehillim and everything will be good. An high functioning, educated person, as a rabbi and the individual, will consult with the Rav and will for sure go and make sure to rule out any medical factors, because a rabbi is educated in his religious practices and a medical doctor is educated in their medical practices. And many things, if it's not paid attention to earlier on, can cause a lot of different damages that sometimes cannot be fixed, and they would make sure to talk to a medical professional. That's the same thing with psychological issues. So if you're presenting with certain issues within yourself or your family members, you need to consult with a psychological mental health professional. And it could be that for you, it needs to be someone that's also familiar with the Jewish practices. So you go to them and make sure to consult with them. There is a fantastic, fantastic author. Her name is Rivka Skonfeld. She has some fantastic, fantastic book writing on different psychological factors that apply to children. She has amazing books regarding ADHD, anxiety, and different psychological factors as it applies to children. And then you have Zichrono Livracha Avraham Tversky's book, who was a Rav and a psychiatrist. He is mamash fantastic. Like, I can't begin to say enough about how beautifully he brings the two worlds together, teaching us how they could work together hand in hand and educate us and help us understand that psychological factors are more than a spiritual um, reading or healing reading, that psychological factors need to be paid attention by psychological professionals. Many times we see people, as I work as a community advocate, and many times, and my husband works as a Rav, we see people coming and struggling and having a hard time, and you see that there is more to this issue than there's more to this issue psychologically than religiously, and it needs to be taken care of by a psychological professional. So I'll give you an example. When it comes to laws of kashrut, when it comes to davening, when it comes to the laws of mikveh, when it comes to postpartum depression, after a woman gives birth, when it comes to anger and rage and like fanatic state of being, when it comes to obsession. Did I do it right? Let me do it again. Let me repeat it again. Let me try again. Let me go over it again and again. And not being mindful of the toll it's taking on the whole family. The fact of when it comes to sudden changes from being modernly religious to suddenly being very, very religious, being meticulous and very detailed without paying attention to the whole picture and being mindful of how your behavior is affecting your family members. Living a religious Jewish practicing life is beautiful, but we should never forget that having shalom bayit, having peace in the house, having harmony, being a good role model for our children is essential. Unfortunately, this past year that we overcame with the pandemic, a lot happened with many families. We heard about suicide cases, depression, drug abuse, overdose within the Frum community, within the Baal Tshuva community. So we should not take these things for granted. We, as the Jewish community, need to be more educated and aware about these symptomologies and provide the right resources and information for our children, for the schools, for the people within the community to refer to the right places and the right people. And as many of you know, I work as an advocate for Jewish children that get detained by Child Protective Services and are placed in the foster system. And I go after the children to try to get them into a Jewish home, to try to get them in the right place, to try to be an advocate and a source to the family. And many times, these beautiful, beautiful, good people don't even know that there are other ways to live their life, that there's help out there for them, whether there's classes, whether there's psychologists and psychiatrist services, whether there is, getting different type of intervention and support group, that there are different ways to live their life and they do not have to be a slave and a hostage to their psychological and mental struggles that they are feeling. We have some fantastic religious psychiatrists here in Los Angeles that I know and I've worked with personally. There are fantastic psychologists and therapists within the Jewish community of LA that do wonderful work. So my message on this video is get the right help. And even if your child or your family member or your spouse refuses to get the help, you get the help yourself to learn how to deal with them, how to guide them the right way. Change is only going to happen with awareness. So psychological factors are not going to go away with tefillot. Psychological factors need psychological intervention. That's the only way to deal with it. And we, as the community,